Welcome to the Reproductive Science Center of New England, and congratulations on taking this important step toward parenthood. For your first visit, we want to explain what you'll need to get started. We also want to briefly explain how treatment works for most patients.
After the patient books their initial appointment on the phone, they will receive in the mail our new patient packet. Inside the packet will be very detailed health history forms for the patient and their partner if they have one. We ask that the patient fill them out and return them at least a week in advance. There's an envelope that's already addressed that they can use to mail it back. The physician likes to receive these a week in advance so that they can prepare for the consultation as opposed to spending time during the consult reviewing their history. They may also receive in the packet treatment handbook and consents, and there will also be directions to the practice as well as information about the physician they're going to see as well as the practice in general. On the day of the initial consult, the patient and her partner, if she has one, should plan to be in the practice roughly 2 hours. The reason being they will meet with the physician for approximately 1 hour for their consultation. Then they will have a seat back in the waiting room while the physician brings the nurse up to speed about what they discussed, and then the nurse will come out and meet with the couple to review the logistics of any testing they may need or any treatment they may need. The couple should also bring to the consultation their driver's licenses as well as their insurance cards, as we copy those at the initial consultation, and they should bring with them the new patient packet they received in the mail as well.
For your clinical treatment at RSC New England, we follow a team approach. You're definitely not alone or reliant on only one person. You'll have a doctor, nurse, embryologist, and other professionals managing your care. And of course, you and your partner are important members of that team as well. We also address your practical concerns and needs, such as cost of treatment, use of insurance, and price plans.
Our goal is really to proactively address the uncertainty and the anxiety that comes along with the cost of IVF care for many of our patients, and to be able to put those concerns aside and allow our patients to focus solely on their clinical care to help give them the best chance for a positive outcome. Insurance coverage for IVF is fairly complex. In today's world with high deductible plans and co-insurance components, the ability to understand exactly what is a covered service and what is not covered service really comes down to the individual's plan. But our financial counselors are very skilled at understanding the variety of plans. They work with plans each and every day to obtain pre-authorizations, and they also understand the various components of many of the plans. So they will work collaboratively with our patients to create expectations and understandings up front, and be able to work with them along the way so that the patients understand exactly what coverage issues they might be facing. For most patients, IVF success is typically going to require more than one cycle. To help patients with that, RSC offers a special multi-cycle program called Attain IVF, which will provide several cycles for a fixed price. One program, it has a guaranteed component that you will get a refund if you do not take a baby home, and the other program is a multi-cycle discount offering for the patient. Our financial counselors can also help patients in obtaining financing to help pay for their IVF cycles if they are paying for it out of pocket. We believe that addressing the financial matters in the practice is a shared responsibility between us and our patients. And our financial counselors strive to be an advocate for our patients in helping them to understand their insurance coverage. If they're a self-pay patient, to understand what the financial obligations are with their care at RSC, but to do it at the start of their care so that we can help avoid any financial surprises further down the line.
The best treatment for your individual needs will be determined by initial diagnostic testing. Your doctor will go over these options with you to create a treatment plan.
At the first visit, it's really an opportunity for the patient to meet the doctor and for us to get to know the patient better. Usually we start out by reviewing the medical history and trying to basically pinpoint where there could be some problems and some issues that maybe we can look at, as well as to take an opportunity to review the typical testing that we do during the workup to determine where the problems may lay. And so we'll typically review the different testing and make a plan going forward of how to arrange for that testing to be done. And a lot of times we'll be able to pinpoint an area where we may be able to improve upon and recommend treatment options based on that. And so once we decide on a treatment option, typically what we'll do is we'll describe the cycle in detail. We'll review the medications, how the medications are taken. We'll review any side effects of the medications. And then we'll sign consent forms. After signing consents and reviewing the treatment plan, the patient will then meet with the nursing team. The nursing team will sit down with the patient, review the treatment plan, and formulate a calendar with specific instructions of what to do during the cycle. Typically that starts with the patient calling with their next menstrual period to initiate the start of the cycle.
When the patients come in to see the physicians for their initial visit, as well as for any visit thereafter where a treatment cycle is being put together and assembled for them, the patients will meet with the nurse either to explain further the testing that they will be undergoing and to explain how to access their nurse, how to make them aware of when their menstrual cycle has begun, and kind of to lay out the process for them. When they're undergoing an IVF or insemination cycle, they would meet with the nurse after that visit with the physician in which the treatment plan was explained to kind of get a cycle calendar, something that can be an ongoing guide for them throughout the process, and to know that the nurse will really kind of help them along every step of the way.
Medical treatment for infertility is definitely a process and often requires more than one treatment cycle.
After we find out a patient's pregnant, we often follow their pregnancy hormone levels. And depending on how they're rising, we either do it every 48 hours or we can do it weekly. And then between 6 and 7 weeks, we'll do an ultrasound to confirm that the pregnancy is both inside the uterus and to confirm a heartbeat. And once we confirm that the pregnancy actually has a heartbeat and it's a viable pregnancy, then we will refer them back to their OBGYNs.
I think one of the most important things that patients should keep in mind is that you're not alone in this process. Fertility issues can seem lonely and isolating, but when you come to Reproductive Science Center, you have a whole team of professionals who are here to take care of you and have invested their time and their energy into helping you every step of the way.
At the start of the patient's journey, we want them to know that we're here to do everything possible to help them have the very best experience in their journey to parenthood.